In today's video, I'm going to discuss about 10 detailed signs that could indicate fatty liver disease, also called hepatic steatosis, and how to reduce the risk and prevent it. Many people don't notice symptoms in the early stages, but as the condition progresses, these signs may appear. 1. Fatigue and low energy. Fatty liver can affect how your liver processes nutrients and toxins. As a result, you may feel tired all the time, even after a good night's sleep. This fatigue can be both physical and mental, leading to trouble concentrating and a general feeling of being run down. 2. Discomfort or fullness in the upper right abdomen. The liver sits in the upper right side of your belly. As fat builds up, the liver may enlarge, causing a feeling of tightness, discomfort, or dull pain under the ribs on that side. It's not usually sharp pain, more like pressure or bloating. 3. Unexplained weight gain or difficulty losing weight. Fatty liver is strongly linked to insulin resistance and metabolic issues. Even with exercise and diet, people with fatty liver may struggle to lose weight, especially around the abdomen. Some may also gain weight easily, especially fat around the belly. 4. Elevated liver enzymes, found in blood tests. Many people find out they have fatty liver because their liver enzymes, ALT and AST, are high on a routine blood test. This doesn't always cause symptoms, but is a red flag that your liver is under stress and may be inflamed. 5. Insulin resistance or type 2. Diabetes, fatty liver, and insulin resistance go hand in hand. If you have prediabetes or type 2 diabetes, you may be more likely to develop fatty liver. Conversely, if you already have fatty liver, it can make your blood sugar harder to control. 6. High triglycerides or cholesterol. Fatty liver often shows up alongside other signs of metabolic syndrome, like high cholesterol or triglycerides. These blood fats can further worsen liver inflammation and fat buildup if left unmanaged. 7. Yellowing of skin or eyes, jaundice. This is a late-stage symptom and could signal that the fatty liver has progressed to non-alcoholic steatohepatitis, NASH, or cirrhosis. Jaundice happens when the liver can't process bilirubin, a yellow pigment in the blood. 8. Swelling in the legs or abdomen, edema or ascites. In more advanced liver disease, you might develop fluid buildup in the belly, called ascites, or swollen legs and ankles. This is a sign that your liver is struggling to make proteins and manage fluid balance. 9. Brain fog or trouble. Concentrating, a poorly functioning liver may lead to a buildup of toxins in the bloodstream, which can affect brain function. This can feel like poor memory, slow thinking, or general mental fog. 10. Dark urine or pale stools. Changes in the color of your urine or stool may indicate liver dysfunction. Dark urine, brownish, and pale clay-colored stools suggest issues with bile production or flow, both of which are liver-related. Fatty liver is often called a silent disease because many people have no idea they have it until it shows up on imaging, like an ultrasound or blood tests. That's why regular checkups, especially if you're overweight or have diabetes, are crucial. Treating fatty liver disease, especially non-alcoholic fatty liver disease, NAFLD, focuses on reversing the fat buildup in the liver and improving overall metabolic health. The good news: fatty liver is often reversible, especially in the early stages. Here's a detailed guide to treating fatty liver naturally and medically. 1. Lose excess weight gradually. Losing just 5 to 10% of your body weight can significantly reduce liver fat. Rapid weight loss can stress the liver, so aim to lose 1 to 2 pounds per week. Focus on reducing belly fat, which is closely linked to fatty liver. Combine diet, exercise, and lifestyle changes, not crash diets. 2. Adopt a liver-friendly diet. Eat more of leafy greens such as spinach, kale, cruciferous vegetables like broccoli, cauliflower, whole grains oats, brown rice, quinoa berries, apples, healthy fats produced from olive oil, nuts, avocado, lean proteins from fish, eggs, tofu, chicken. Also, you should avoid any added sugars such as sodas, sweets, pastries, refined carbs like white bread, pasta, fried and fatty foods, excess alcohol. Even small amounts can worsen liver stress. 3. Exercise. Regularly aim for 30-45 minutes of moderate exercise 5 days a week. Combine aerobic, walking, swimming, cycling, and resistance training, weights, body weight exercises. Exercise improves insulin sensitivity and helps burn liver fat. 4. Manage blood sugar and insulin resistance. High blood sugar worsens fatty liver. If you're pre-diabetic or diabetic, monitor fasting glucose and A1C levels. Limit simple carbs and sugar. Medications like metformin, if prescribed, may help insulin resistance and reduce liver fat. 5. Take medications, if prescribed. There's no universal drug approved for fatty liver, but doctors may prescribe treatments for related issues. Vitamin E, in some cases. Powerful antioxidant shown to reduce liver inflammation. Pioglitazone, for patients with diabetes or prediabetes. Statins, if you also have high cholesterol, safe in most fatty liver patients. New treatments, like semaglutide for obesity or GLP-1 agonists, are showing promise. Only use medications under a doctor's supervision. 6. Avoid alcohol. Even moderate alcohol can worsen liver inflammation in people with fatty liver, even if it's non-alcoholic fatty liver disease. If you have fatty liver, it's best to avoid alcohol completely. 7. Get quality sleep. Poor sleep and sleep apnea are linked to fatty liver. Aim for 7 to 8 hours of sleep each night. If you snore heavily or feel exhausted during the day, ask your doctor about sleep apnea screening. 8. Reduce stress and inflammation. Chronic stress can contribute to hormonal imbalances, poor lifestyle habits, and increased liver fat. Practice stress management, meditation, deep breathing, journaling, therapy. Anti-inflammatory habits, like a healthy diet and exercise, support both mood and liver health. 9. Monitor liver health with your doctor. Ask your doctor about liver enzyme tests, ALT, AST, imaging scans such as ultrasound, FibroScan fibrosis markers to check for early signs of liver scarring. Early detection and regular monitoring are key to avoiding progression to NASH or cirrhosis. 10. Consider natural supplements with caution. Some evidence-based supplements that may help, under medical guidance, such as milk thistle, silymarin, antioxidant support, omega-3 fatty acids, reduces liver fat, turmeric, curcumin, anti-inflammatory. Always check with your healthcare provider before starting any supplement, especially if you take other medications. I hope this discussion was helpful to you. I'd really like to hear your thoughts. What was the most surprising thing you learned today? Leave a comment below, and let's keep this important conversation going. Thank you all for watching the video. I hope you liked the video. Please like, share, and leave a comment. Also, don't forget to subscribe and turn on the notifications for more videos like this. See you in the next video. Until then, take care.